Hi, my name is Hisham bin Masoud. I am a general practitioner consultant and emergency medicine consultant. In addition to that, I am an IMCI consultant for UNICEF organization. Today we'll talk about new topic in the IMCI program. Assess, classify, treat, follow up, and counsel for ear problems in age group between 2 months until 5 years. Our objective today is to assess and classify the sick child complaining of ear problem. We treat the child complaining of ear problem, counsel the mother for ear problem, and give follow-up care for ear problem. As I mentioned before, this is the approach of IMCI. Firstly, we have assess and classify the sick child, and then treat the child, counsel the mother, and give follow-up care. As the overall picture for the ear problems, we know the ear problem is a common below 5 years. And we know that rarely it causes deaths, but it's one of the leading causes of deafness in children, and also one of the causes that reduce performance at school. This is the patient flow. Firstly, we should assess the danger signs at the triage site. Just remind you about the general danger signs. If the child is not able to drink or breastfeed, the child vomits everything, the child has had a convulsion or is convulsing now, the child is lethargic or unconscious. This child, if have one of these, should be assessed as very severe disease and referred immediately to the treatment room for quick assessment by direct physicians and giving a pre-referral medication before transferring urgently to the hospital. If not, the child have no one or any of general danger signs, we should ask about main complaints. If the mother says the child complain of ear problems, we should check for specific child danger signs, which is called feel and look for tender swelling behind the ear. If there is a bone tenderness and swelling behind the ear, we should classify the child as has a mastoiditis. And we should refer him to the treatment room. So the mastoiditis is a deep infections in the mastoidal bone, and we shouldn't confuse between swelling in the bone or swelling of lymph nodes. So as we mentioned, if the child have any of general or specific danger signs, should refer it urgently to the treatment room and assess it quickly by the direct physician and giving pre-referral medications, and after that refer it urgently to the hospital. And after that, if the child doesn't have one of these general or specific danger signs, child can be waiting in the waiting area before seen in the examination room by direct physician. At the examination room, the doctors can ask other questions. And by these questions, we classify the child into two categories, or yellow and green zone. In the yellow zone, we classify in two classifications, acute ear infections or chronic ear infections. Or in the green ear zone, we only classify as other ear problems. Now we go further deep an assessment for ear problem. So as we remind you before, we should ask, does the child has an ear problem? If the mother answers no, record the answers and don't assess the child for ear problems. Go to the next questions. If the mother answers yes, you should ask these questions. You should ask, does the child have ear pain? Ear pain can mean the child has ear infections. If the mother is not sure that the child has ear pain, you can ask if the child has been irritable or rubbing his ear. And then you should ask, is there ear discharge? If yes, you should ask for how long. Ear discharge is also a sign of infections. When asking about ear discharge, use words the mother understands. If the child has had an ear discharge, ask for how long. Give her time to answer questions. She may need to remember when the discharge started. You will classify and treat your problems depending on how long the ear discharge has been present. Any discharge that has been present for 2 weeks or more is treated as a chronic ear infection. Any discharge that has been present for less than 2 weeks is treated as an acute ear infection. After that, you should look for, by examination, if there is a pus drain from the ear. Pus draining from the ear is a sign of infections. Even if the child no longer has any pain, look inside the child's ear to see if the pus drain from ear. Feel for tender swelling behind the ear. Feel behind both ears. Compare them and decide if there is a tender swelling of mastoidal bone. In infant, the swelling may be above the ear. So the bone tenderness and swelling should be compared together to classify as mastoiditis. Now we go to the classification. So we have three categories of classification: the pinky one, mastoiditis; the yellow one, either acute or chronic ear infections, depending on duration of the ear discharge. If it's less than 2 weeks, it's acute. If it's for more than 2 weeks, it's chronic. Or in the green zone, other ear problem. Treat the child with the ear problem. In the mastoiditis, we should refer him to the treatment room and give first dose of appropriate antibiotic. We give first dose of paracetamol for pain. We refer urgently to hospital. In acute ear infections, we give an antibiotic for 5 days. We give paracetamol for pain. We dry the ear by wicking and follow up in 5 days. In chronic ear infections, we dry by ear wick, treat with topical quinolone ear drops for 14 days and give follow-up care after 5 days. In other ear problem, treat according to the existing guidelines. About the now detailed for treatment. Now we're talking about medications. We should have an instructions for the medications. We should determine the appropriate drugs and doses for child's age or weight. Tell the mother to the reason for giving the drug to the child. Demonstrate how to use and measure the dose, and watch the mother practice measures a dose by herself. Ask the mother to give the first dose to her child. Explain carefully how to give the drugs. Then label and package the drug. If more than one drug will be given, collect a count and package each drug separately. Explain that all tablets or syrup must be used to finish the course of treatment, even if the child gets better. Check the mother understanding before leave the clinic. About antibiotic treatment. We give for acute ear infections, we give first line antibiotic is oral amoxicillin. Amoxicillin is the recommended first line drug of choice in treatment of acute ear infections due to its efficacy and increasing high resistance to cotrimoxazole. There is three categories of doses. We have 5 ml, 10 ml, 15 ml of amoxicillin syrup in the concentration of 250 mg per 5 ml, and these categories classified according to the age group between 2 months until 1 year, and from 1 year to 3 years, and 3 to 5 years. So, but in 2 months until 1 year, we give a 5 milligram, 5 ml syrup. Between 12 months and 3 years, we give 10 ml. Between 3 years and 5 years, we give 15 ml. And the treatment twice daily. In treatment for chronic ear infections, we clear the ear by dry wick and give ear drops. Do the following 3 times daily. We are rolling clean absorbent clothes or soft and strong tissue papers into the wick. Place the wick into the ear of the child and remove the wicks when wet, and then replace it with the other one until become clean and dry, and repeat the steps until dry. Instill quinolone ear drops for 2 weeks. Quinolone ear drops may be using ciprofloxacin, norfloxacin, or ofloxacin. About the painkiller, we can give medications, paracetamol 6 hourly in a dosage of, in concentration is most commonly present, 120 milligram per 5 ml. In age group between 2 months and 3 years, we can give a 4 ml. And the age between 3 years and 5 years, 6 ml. At the follow-up care for ear problems, after 5 days, the child come again to the clinic and we check for child for general danger signs. We measure the temperatures. We ask if there is any new complaint or new problem, assess and classify and treat and do new problem. In the treatment, if there is a tenderness, swelling behind the ear at the follow-up, or high fevers, then we should refer urgently to the hospital. If it's classified before as acute ear infections, the categories will be one of the 3. If the ear pain or the charge persists, treat with 5 more days of some antibiotic. Continue wicking for dry ear. Follow up in 5 days. If no improvement after 10 days of treatment, refer to the ENT. If no ear pain or discharge at follow-up, we just praise the mother for her careful treatment. If she has not yet finished 5 days of antibiotic, tell her use to finish the dose and use all of it before stopping. In chronic ear infections, we just check that the mother is wicking the ear correctly and giving quinolone drops 3 times a day. Encourage the caregivers to continue. In counseling about the mothers for ear problem, firstly, we have a safety net. We advise the mother to return immediately if the child has any general danger signs, becomes sick, or develop fever. At home care, we should insist about ear wicking to dry the ear from the charge, and that by learn her how to do it properly, and instilling a quinolone if it's a chronic infections. We advise the mother to increase fluid during illness, and that by, if the child is pure breastfeeding, more frequent and for long at each fed. If the child is taking breast milk substitute, we increase the amount of milk giving. And if he taking any foods, we give increasing fluid intake by giving soups, rice water, yogurt drinks, and clean water. Promotion advocacy. If it's proper, we advise the mother for next well child visits and immunization. Thanks for listening.